The transfusion of blood products, such as packed red blood cells, plasma, or platelets, is a task that requires the use of specific equipment, as well as the following of specific procedures, in order to guarantee the safety of the recipient. This video will demonstrate and explain the steps that must be taken to prepare for a blood product transfusion. In other words, the steps to take before releasing the blood product from blood bank. It begins with an order. To transfuse blood products, 2 orders will actually be needed. The first order will be for the product to be prepared. This is the order that triggers blood bank to have the appropriate product ready for use. This does not give permission to administer the product to the patient. The second order is to transfuse the product. This is the order that gives the nurse the ability to administer the blood product. The nurse cannot administer a blood product unless there is an active order to transfuse that product. Taking a closer look at this particular order, you will notice that 2 units were ordered to be prepared for this patient, but only 1 unit is ordered to be transfused right now. That second unit will not be given at this time, but will stay available in blood bank in case further transfusion is necessary. Another order that will accompany blood product transfusion is the type-in screen. This will need to be drawn and resulted before any blood product can be prepared. If there is a valid type-in screen previously resulted, it may not be necessary to draw another one at this time. If the prepare and transfuse orders are in place, as soon as blood bank has the product available, it could be released to the floor. But before you release that blood, there are some tasks that must be completed. Verify your patient's IV access. The patient must have an IV. A 22 gauge is the minimum requirement, but larger gauge IVs will flow more smoothly. Verify that the patient has a signed consent for blood in the hard chart. There are 2 options. The first is a consent for transfusion of blood and/or blood products. The patient, a witness, and the physician will need to have signed this in order to make it valid. The other option for consent is a passage in the consent for surgery and invasive procedures. At the bottom of this form, there is a section for blood that states that the patient consents to a transfusion for the duration of this hospitalization. Check the patient's vital signs. Ensure everything is within expected ranges. If there are any concerns regarding the patient's vitals, consult with the physician before moving forward with the transfusion. Make sure these pre-procedure vitals are entered into Epic. With an IV in place, consent on the chart, and vitals within expectations, the next step is to gather the necessary supplies. All you will need is a small bag of saline. A small volume bag such as 100 milliliters or 250 milliliters is all that will be necessary for a blood transfusion. Normal saline is the only IV solution suitable for transfusion of blood products. For tubing, you will need a primary plumb Y-type blood set. Let's take a closer look at the tubing. Y-type blood tubing sets have 2 spikes. One of these will connect to a saline bag. The other will connect to a blood product. The 2 spikes are identical, so it doesn't matter which one is used for either solution. They connect to a large filter chamber, which then connects to a standard cassette used for all Plumb 360 tubing, and then it continues until it connects to the patient. We will begin by priming the tubing with saline. Close both roller clamps. Then connect the bag of saline to one of the spikes. Hang the saline bag from an IV pole and open the roller clamp below the saline. Squeeze the filter chamber multiple times to draw in saline until that saline fills to just above the top of the filter. Then continue to prime the cassette and the rest of the IV tubing with saline, as you would a normal primary IV tubing line. Invert the cassette. Pull the white plug open. Saline will begin to fill the large chamber on the cassette, and once it has completely filled, flip the cassette to allow it to continue to fill the remaining chambers and push all air out of the cassette. Then allow saline to run through the rest of the tubing before pushing the white plug closed. Then, close the roller clamp below the saline bag. It is possible to prime the tubing with blood product once it has arrived, but at Trinity Health Livonia, blood tubing is primed with saline for a couple of reasons. First, it is the manufacturer recommendation that it be primed with 0.9 normal saline. But secondly, and in my opinion most importantly, if during priming air bubbles are introduced into the cassette or line, it may be necessary to waste some fluid to clear the air from the set. It is totally acceptable to waste all the saline you need to in order to clear that air. But blood products are a special commodity, of which the world is always in shortage. If you have to waste blood product to clear air, every drop of blood wasted is a drop of blood that won't make it into a patient that is in dire need of it. Respect the blood and blood products. Don't waste them. Always prime with saline. You're now ready to release the blood product. Go to the Blood tab in the flow sheets. Click on Transfusion Report in the left column. A new window will open. click on the Release hyperlink. This will prompt Blood Bank to send the blood to the floor. After releasing the blood product, it will be sent to the floor from Blood Bank, and upon its arrival, you will continue the process of administering a transfusion. Those steps are explained in separate videos.